How does adamantinoma bone cancer impact the tibia? Imagine a tiny but persistent growth slowly taking hold of the shin bone in the lower leg. That's what happens with adamantinoma, a very rare type of bone tumor. It is considered low-grade, meaning it grows slowly, but it can still cause serious issues if not caught early. This tumor mainly affects the tibia, which is the large bone in the front of the lower leg. It makes up less than 1% of all primary bone cancers, so it is quite uncommon. Because it grows gradually, patients might notice a lump or swelling in the middle part of the tibia. Sometimes there is mild pain or discomfort that can last 4 years before anyone seeks medical help. As the tumor enlarges, it can weaken the bone structure. This weakening happens because the tumor infiltrates or invades the bone tissue, leading to areas of destruction. When the bone becomes fragile, it increases the risk of fractures, even with minor injuries or no trauma at all. In addition to weakening the bone, adamantinoma can cause deformity. The tumor's growth may lead to bowing or curving of the tibia, which can make the lower leg look misshapen. This deformity occurs because the tumor disrupts normal bone growth and remodeling processes. Patients often experience localized pain and swelling over the affected area, which might be dull or persistent. These symptoms can impact daily activities, making walking or standing difficult. Although classified as low-grade, adamantinoma is still considered locally aggressive. This means it can invade surrounding soft tissues if not treated promptly. The tumor's slow growth does not mean it is harmless. It can cause extensive damage to the bone and nearby tissues over time. Diagnosing adamantinoma involves imaging tests like X-rays, magnetic resonance imaging, or computed tomography scans. These help determine the size, location, and extent of the tumor. A biopsy is essential to confirm the diagnosis and distinguish it from other conditions such as osteofibrous dysplasia, which is benign but can look similar on scans. Treatment usually involves surgery to remove the tumor with a wide margin to prevent recurrence. Sometimes, reconstructing the tibia is necessary to restore function and stability. Because the tumor grows slowly but can cause significant damage, early detection and intervention are crucial. In summary, adamantinoma impacts the tibia by causing a slow but potentially destructive growth that weakens the bone, leads to pain, swelling, deformity, and impairs mobility. Managing this tumor requires careful diagnosis and surgical removal to protect the bone's structure and preserve leg function. Always consult healthcare professionals for personalized advice and treatment options.